Next topic is sleep in diabetes. Probably this is the most underrated lifestyle change in the prevention and management of diabetes. The speaker is Muruganathan sir. He is a director of JPEF Physicians Research Foundation, member Tamil Nadu Medical Council, is a director of Resolve to Save Lives. He's a BC Roy awardee and the past president of Hypertension Society of India and the past president of API, and happy to see that he is also the past state president of Tamil Nadu State Indian Medical Association. Over to you, sir.
Thank you very much. The topic I have chosen is the missing hours, how sleep saves the diabetes equation. See, everybody knows the importance of sleep. Sleep is a biological process. It is essential for life and optimal health. Not only for us, for the animals, for everybody. But normal healthy sleep should be of sufficient duration, good quality, appropriate timing and regularity, and absence of sleep disturbance. You know, many people will say, I went to the late show and then to compensate that I slept up to 10 o'clock in the morning. Though the duration of sleep is good, okay, but the circadian rhythm is varying. So that's why it should be appropriate timing and regularity. Plays a critical role in brain function, systemic physiology, including metabolism, appetite regulation, immune, hormonal and cardiovascular system. Getting inadequate sleep over time can raise risk of chronic health problems, including obesity. I already told you, it's a restorative function, information processing and memory consolidation, mood regulation. If you don't have a good sleep, next day morning your mood may not be good. Thermoregulation, strengthening immune system. In fact, when the COVID time, they did an analysis. The interleukin 12 supposed to be the good immunomid hormone which protects, that is secreting in the human being when they sleep at 10 p.m. to 11 p.m. Then hormonal regulation. There was life essential, because now whenever we say lifestyle modification, they forget about sleep. In life's simple 7 is no smoking, healthy weight, healthy diet, moderate physical activity, total blood cholesterol, everything. But now the AHA, American Heart Association, includes sleep as the life's essential 8. The 8th factor is good sleep. Then coming to my topic, what is the importance of sleep in diabetes? For individuals with diabetes, the quality, the quantity of sleep are not just aspects of overall wellness. They are the crucial components of effective disease management. Both in type 2 and type 1, type 2, adequate sleep becomes an even more vital due to the resonative effect on insulin sensitivity, glucose metabolism, appetite regulation, and increase the risk of complication, and even it can play a role in the development of diabetes. Then a word about physiology of sleep. Sleep is actively regulated, periodically occurring state of decreased consciousness, muscle relaxation, and altered responsiveness to stimuli. Based on the patterns of brain electrical activity, eye movements, and skeletal muscle tone, human sleep is separated into distinct stages: NREM sleep and REM sleep. Again, NREM sleep has got 3 stages, and stage 3 is called slow wave sleep. REM occurs every 60 to 90 minutes, initially as a short episode, but progressively increasing. The sleep onset and periodicity are precisely controlled process determined by 3 major factors. What is circadian rhythm, homeostatic drive, and emotional or cognitive inputs. Then stage 3 type, slow wave sleep is very important, I tell you. The slow wave sleep is a state of deepest sleep characterized by low frequency, high amplitude, delta waves in the brain. It is highly restorative sleep, important for physical repair, growth hormone release, memory consolidation, and immune function. So slow wave sleep is very important for metabolic homeostasis, with brain glucose utilization and sympathetic nervous activity being reduced and parasympathetic activity increased. Selective suppression of slow wave sleep without perturbation of total sleep results in glucose tolerance, insulin resistance, and decreased beta cell function. So somebody has not got a good slow wave sleep, they'll have more insulin resistance and decreased beta cell function. The slow wave sleep suppression also causes decreased satiety perception and decreased fat oxidation, leading to adipose tissue accumulation. So my previous speaker talking about adipose tissue accumulation, one of the factors may be the sleep disturbance. Hence, slow wave sleep is likely to play a major role in total body glucose regulation. Then what are the hormonal changes occur during sleep? Sleep deprivation or sleep disturbance increases the circulating cortisol, sympathetic activity, and epinephrine secretion. Increase in cortisol causes increase in blood sugar, and very important, it decreases leptin, a hormone which is important for signaling satiety, causes increased appetite and food intake. Short sleep time is associated with increase in ghrelin, which increases appetite, down-regulation of satiety and adipogenesis, fat catabolism, and lipolysis. This might be one of the main reasons why individuals with short sleep duration are prone to gain weight and increase the rise of developing OSA and type 2 diabetes. Decrease in circulating testosterone, decreased TSH, decreased pulsality of growth hormone, and changes in adipokinins secreted from the adipose tissue. So sleep changes all these hormones, and sleep disturbance, they say in the nurses health study, they found out over 70,000 women, if their normal duration of sleep is good, everything is normal. If there is a sleep disturbance, 1.6 times more people will develop diabetes or change in glucose, and if they have less than 6 hours of sleep, again the problem is there. They analyzed the nurses heart study, and they also studied after 6 nights of restricted sleep for 4 hours, they found out insulin sensitivity reduced by 25%. Just 6 nights, they found out 25% insulin sensitivity is reduced. Again, the pathophysiology of mechanism, remember about circadian rhythm. Circadian disruption, the pacemaker of circadian rhythm is in the suprachiasmatic nucleus of hypothalamus, which regulates glucose metabolism, insulin sensitivity, adipocyte gene expression, and circadian misalignment as seen in shift workers. Many times, shift workers, especially the youngsters, when they do nighttime work from home, they do nighttime studies, nighttime work. So that misalignment with irregular sleep-wake cycle leads to temporal mismatches in hormone release, increasing diabetes risk even when sleep duration is preserved. Circadian rhythm, 24-hour biological clock regulating metabolic process, circadian misalignment, disruption leading to metabolic dysregulation, and hormone timing, precise temporal regulation of insulin, cortisol, and growth hormone, and metabolic function is also deranged. The inflammatory path, I already told you, the systemic inflammation, cytokine elevation of interleukin 6, TNF alpha, CRP elevation in circulation, and this finally causes beta cell damage. Again, shift workers, if you see shift workers, they have a circadian misalignment, I already told you, working when the body is programmed for sleep. Altered meal time, eating during the biological night when metabolism is slower, and metabolic dysfunction and increased diabetic risk. Long-term shift workers, they will have a more chance of developing diabetes. How sleep affects blood sugar levels, I'll summarize. One is impaired glucose tolerance, increased insulin resistance, disruption of circadian rhythm, and overeating and weight gain. See, sleep deprivation increases hunger and cravings. You can see many people who are not having good sleep, they have a hunger, cravings, particularly for high-calorie food, high-calorie, carbohydrate-rich foods. This is primarily due to reduced leptin and increased ghrelin. Additionally, chronic sleep loss can affect decision-making and mood, potentially reducing the motivation to adhere to healthy lifestyle choice and then exercise and balance eating. And common sleep disorders in diabetes is insomnia, and then sleep apnea, and restless leg syndrome, uncomfortable sensations in the leg causing frequent awakening. In uncontrolled diabetes, people getting up and going to bathroom all the night and not sleeping well. And sleep duration and the risk of diabetes studies, we have found out 10 articles with 11 reports were eligible to inclusion, A total number of 18,443 incident cases of type 2 diabetes ascertained among 482,000 patients. The lowest risk was observed when they sleep between 7 to 8 hours. The highest risk was when they sleep less than 6 hours. A study by Spectral, 2-day sleep restriction is associated with 18% reduction in the circulating leptin and 28% in ghrelin. So even 2 nights sleep restriction can cause these hormonal changes. And OSA and glycemic control. Now we talk about OSA in every field, in hypertension, resistant hypertension, in obesity, and also in respiratory problems, also in diabetes. OSA is present in 3 to 7% of population, is not only important risk factor for CVD, it also causes metabolic alteration. There is high level of sympathetic nervous activity during sleep and wake time. This causes increased circulating catecholamines, resulting in increased glucose production. Individuals diagnosed with DM should be screened for OSA. So when somebody comes to you with OSA, look for diabetes. When somebody has got diabetes, ask them for OSA history from his spouse. Pathogenesis of metabolic abnormalities in sleep apnea, hypoxia, arousal, and glucose intolerance, insulin resistance. And the sleep apnea or sleep fragmentation causes intermittent hypoxemia, sympathetic activation, then hypothalamus nucleus dysregulation, systemic inflammation, and that leads to insulin resistance, that leads to type 2 diabetes and beta cell dysfunction. This is the pathogenesis in sleep apnea. And then the sleep heart health study, recently we have said higher apnea hypopnea index scores correlated with elevated fasting glucose. The relationship between OSA and glucose dysregulation remains significant even after adjusting BMI. Increased 2-hour glucose levels were observed in those with more sleep apnea. Patients with diabetes showed higher prevalence of periodic breathing and central apnea. This is the sleep heart study findings for the patients with sleep apnea. And how diabetes can cause sleep disturbance. They see diabetes and sleep is bidirectional. The diabetes can cause sleep disturbance and sleep disturbance cause diabetes. So how diabetes can cause sleep disturbance is one by autonomic neuropathy, impairs central respiratory control and contribute to sleep disorders, nocturia, frequent nighttime urine, peripheral neuropathy because of the painful sensation, they may not get good sleep, altered sleep architecture. So this is how diabetes can cause sleep disturbance. I was telling you how sleep disturbance causes diabetes, and this is how diabetes can cause sleep disturbance. To improve sleep quality, adhere to diet plan, help keep blood sugar levels controlled, get regular exercise, regular physical activity, practice good sleep hygiene, monitor blood sugar levels, careful management of blood sugar levels can improve good sleep. And then cognitive behavioral therapy, behavioral interventions like cognitive behavioral therapy for insomnia and sleep hygiene education. Then you should not have, we always say detoxification of the digital. So you don't see television or WhatsApp before 2 hours before you sleep. So you have a good sleep hygiene practice. And then now emerging technologies in sleep diabetes management. Continuous glucose monitoring, everybody know. Advanced sleep trackers. You see there are a lot of rings. You see I'm wearing a ring which tracks my sleep pattern. So I know my sleep pattern is good or not. So every time I find out, for the last 1 year I was wearing, at least only 2 days I had a good sleep. All the other time, I have different problems. So this gives you how much you had a good sleep, how much you have slow sleep. So sleep trackers are also available. And then now AI powered. Now my previous speaker talking about precision medicine. Now precision medicine also applicable to sleep also. So machine learning algorithms identifying personalized patterns between sleep metrics and glycemic control. And there are a lot of guidelines. American Diabetic Association now recommends sleep disorders as a part of comprehensive diabetic evaluation. So if you do a diabetic evaluation, you should have a detailed study. American Academy of Sleep Medicine joint guidelines recommend CPAP therapy. If you give a CPAP therapy for a sleep apnea, they get better. And sleep duration 7 to 9 hours is recommended. This is how you manage sleep assessment, integrated approach, ongoing monitoring, glycemic management, lifestyle modification. And then future research, everybody now talks about personalized medicine, precision medicine, personalized intervention, and novel therapeutics like development of targeted pharmaceuticals, technology integration, and implementation sciences. As per latest recommendation, you ask somebody coming to your clinic, do you have a good sleep? If they say no, check the blood sugar. If they are diabetic, check for the diabetes are intimately linked in a complex bidirectional relationship. Sleep loss, whether in the form of deprivation, fragmentation, or OSA, predisposes individuals for insulin resistance and diabetes. Conversely, diabetes exacerbates sleep disorders by a neuropathy, nocturia, and altered sleep architecture. Recognizing and addressing disturbance of diabetes management not only answers the central, so bidirectional relationship, integrated approach, multiple mechanisms, and I already told you about future directions. So take home message, sleep well and on time. Sleep is the foundation of good health. Sleep is that golden chain that ties health and our bodies together. Early to bed and early to rise makes a man healthy, wealthy, and wise. So sleep is the best meditation. Thank you for your patient hearing. Thank you very much.
Thank you. Thank you very much, sir. The floor is now open for questions and comments on the three topics, the SOLIUPS push-ups, variability in obesity, and the sleep in diabetes. Singh sir, can I have a question, sir? What about this, the effect of this SOLIUPS push-ups in persons with diabetic neuropathy? Will it be so effective like other person without neuropathy?
He is asking about the effect of SOLIUPS push-up, whether in a diabetic neuropathy cases you can do or not. That's your question, sir. As I told you, sir, not in the world today, not a single paper, single intervention exists where they have tested this. So I think we are going to test this for the first time. But I think one of our, he is also, Dr. Sandupal is also in our center for doing that. So we are also going to look for that neuropathy factor. But I think usually you can do, sir. With neuropathy, it is not a walking, not an active exercise. So if there is even problem with proper footwear, also you can do that. So we will also see because there is no literature, so I cannot tell you anything.
The thing is that there are two different mechanisms, I think. One is the exercise part. Second, to this proprioceptive stimuli, to the PSO2 receptors. There is a receptor, important receptor, to the pancreas. So there is an effect through this receptor to the pancreas so that the insulin is also increased. That is another mechanism. That is why I am asking. The effect is due to the exercise part as well as the proprioceptive part that will reach the pancreas itself. That is why
I am not aware about that. I will look for that. Yeah.
I have
regarding sleep, sir, I think there are lots of problems. It is very difficult to tell or very easy to tell that proper sleep is essential. But in most of our diabetic patients, sleep is a big problem. So instead of going for all these things for diet, because the screen time has increased, everyone is every moment busy with the mobile. So that is, I think, a biggest problem which has emerged and where there is sleep deprivation is going on. So what are the solutions? Because you cannot say, even our, I think, 5 years kids, they are all tuned only for on the mobile. So sleep is really a big problem. So basically we are doing some pill we are giving. But sir, what is the real, how to solve that problem?
Definitely I agree. Though we talk so much about sleep, we ourselves do not know how to get good sleep. You see, we always, when we sleep, we think about Trivandrum's talk tomorrow. So something going on in our mind. And it's a blessing to have a good sleep, and then especially the slow wave sleep.
Yes.
That is why the yogis, when they do meditation, they know how to control their body, they control the sleep. So meditation is one of the methods, and you avoid whatever I said, sleep hygiene, avoid watching television, avoid watching computer or WhatsApp, especially WhatsApp, big problem. Everybody before they go to sleep, they see WhatsApp and they forward. And also some diets, there are certain diets which are very good for good sleep. You ask your grandmother, she will tell you what diet you take to, get good sleep. And, in those good old days, they know sleep is important. That is why they have a separate music also, melody. The mother will, fondle the child in a beautiful way. So there are so many ways, natural ways of developing sleep. I am also trying to get the sleep medicine in a better way. And as somebody said, obesity physician, we must also have a sleep physician.
Yes,
I have a question.
If possible, we should actually cultivate a sleep habit. That's very important. We are losing this sleep habit. That's very important. And sleep is part of the circadian rhythm. That also should be remembered. As the days go by, what Sir was telling regarding the Ganma's diet, it's all related to be it the diet, be it the sleep, it's all related to the circadian rhythm. And if we try to maintain the rhythm, we'll be much better off in the days to come.
So the last question will be from Paniku sir.
Thank you for steering this insightful session. Small changes in behavior often create the biggest health gains.
Just one thing, I have a question. Actually, all the topics were extremely good. Regarding the sleep, are you regularly sending your uncontrolled diabetic patient for any sleep study? That is one question to Muruganathan. And another thing is, as doctor told, the sleep habits has to be learned from childhood. It is not something when you have a heart attack, after that I will try to sleep. It is not. It should be trained with our children, grandchildren from the early childhood. That is very important.
Our ENT surgeon gave a good point, He was doing a lot of studies, especially in children, when they have a tonsil or adrenal enlargement. When they do the operation, their snoring is better, sleep pattern is better, their health is better. That's what he was telling me during tea time. So that was additional point. Even children, they have a sleep disturbance because of these problems, and ENT surgeon is there. As I showed you in the last slide, whenever somebody has got diabetes, look for sleep study, because I was telling everyone, even if you have disturbed sleep for 6 hours, 6 days, the insulin sensitivity is lost. And many people like us overwork, or they sometimes change the timing. We work up to 2 a.m. and sleep up to 8 a.m. or 10 a.m. That's not correct, because somebody said circadian rhythm is the key. You must eat on time. You must eat on time. You must play on time. You have to love your wife on time and sleep on time. So that circadian rhythm you have to maintain. Otherwise, your lifestyle will go away. So I think most of you may not agree, but this is how you should do. So circadian rhythm is the key. That is why in the circadian rhythm, the heart variability, BP variability, everything happens if there is a disturbance. Center is hypothalamic, suprachiasmatic nucleus. That is the control nuclear power for all the circadian rhythm. And what was the third question? Okay, yeah, everything should start with childhood. See, if you have a good habit, good values, you have to bring up your child in such a way. So parenting is important, teaching is important, teachers have a role. That is why even diabetic control, teachers have a big role. So develop a good habit. That good habit should grow. And at the point 10 o'clock, if somebody wants to sleep, they should sleep. So many people, they sleep on time, especially elderly. Old people, they sleep on time. So you have to develop habit. Habits are very important. So thoughts are important. Thoughts will make the habits better, and habits make your life better. Thank you.
Yes, so sorry to cut off the discussion, but we are running out of time. That's why, sir. Thank you so much.